Good morning. I'm Vicki Liviakis. Welcome to Body Beautiful. This is a show where we talk with local professionals about the latest in cosmetic procedures and medical devices. We also take your calls live on the air. And with us today, we have a plastic surgeon, Dr. Elizabeth Lee. We love talking with her. In fact, this show is really going to be a good one. We're calling it Fun with Fillers. We'll tell you what that means coming up. But later on, we'll be taking your calls, answering any questions you have about fillers or plastic surgery. Here's the phone number, 800-440-4884. That's the number. We'll also be posting the number to the doctor's office, so be ready to jot that down. And before we get started, any advice we give you today, obviously you're going to want to consult your own physician for a second opinion. Let's jump right into it. Welcome back to the program, Doctor.
Thank you.
You've come back with a glow on your face and looking rested. You have spent some time in the Greek islands?
Yes, we had a wonderful time.
Okay, is that your only secret, or are we going to talk about anything else that you've done to yourself?
Oh, you always do this.
I love to put you on the spot.
You know, what I do is oabgi skincare, and I do botox, and the most important thing that I think I do is filler.
Filler on your lips.
In my lips. That's right.
Those are fantastic lips, and we're going to actually show how you get to that. We actually have a video that we want to show. But first, just tell me, when we talk about fillers, just briefly, what kind of products are we talking about?
Well, nowadays, the products are mostly hyaluronic acid and also calcium hydroxyapatite. These are chemicals. They're not derived from any kind of animal, as the old collagen was. The collagen that we're used to come from cows or from humans.
And people would have allergic reactions
to the cow collagen.
Well, just the idea of injecting some foreign substance into your body. You like hyaluronic acid because...
I love hyaluronic acid because it's equivalent to the hyaluronic acid that's in your body. There have been very limited, if any, allergic reactions. And the thing that I really like about it is that when you use hyaluronic acid, it can be corrected. You can inject an enzyme that will make a lump go away.
All right, we've been talking, but now we're going to finally show. I actually had a chance to visit your office and catch one of your patients getting some filler work done. So a little warning here, though, if you are squeamish about needles, you might want to just turn away briefly, but it's not so bad. Let's go ahead and roll that tape.
These lines that have appeared suddenly on my lip, and then these, I guess you call them laugh lines.
Howdy-doody lines. Are those these?
Yeah.
Okay, we can help with that.
Dr. Elizabeth Lee preps for a session of filler injections with her patient. She makes sure the surrounding skin is totally numb. Jacqueline's main concern, these tiny lines around her lips.
I always thought it came from the lipstick tube. I was surprised to hear that it's a natural thing. It's not from using lipstick.
Jacqueline's here because a friend raved about her results.
I got to see the results of my friend, so she turned out great.
The fillers being used are Restylane and Perlane.
And the Perlane is a hyaluronic acid product. It's made with recombinant DNA technology, so it's equivalent to the hyaluronic acid that is in your body. How are you doing? Okay. Do you feel anything going down to your lip? Mm-hmm. Good. It is sculpting, and it really feeds my artistic interests, and it is immediate, and it's also extremely low risk. This wrinkle is never going to go away completely, but we're going to soften it so that you don't have to notice it anymore. Okay. So can you see the difference?
The left half with filler, the right half without.
It's natural looking.
Natural, not obscene.
Not misshapen and not too long. And no, we're not going to get rid of this wrinkle altogether right here, because in order to do that, we would put so much in her that she would look weird. I don't like to make patients look like Goldie Hawn in the First Wives Club, and they're usually quite relieved that that's the case. Being able to do this and help patients immediately and have them feel better as soon as they leave is fabulous.
So, after about an hour,
she's definitely the swelling's gonna go down.
The full mouth complete.
Cool. It looks great.
Oh, wow.
Okay, now look at how much improved this is.
Yes.
And look in here all the way down there.
Mm-hmm.
Do you see the difference?
Yes.
So what do you think?
It looks great.
It's fun. Yes, it's great.
Well, she is very happy. In fact, we have some photos of her, like I guess it's, a month later with the makeup on, so it's
right.
Amazing
and with the swelling
stuff.
down and with the mobility of her mouth back because the local anesthetic is worn off.
All right, we got to take a quick break, but